So sagging in the lower face is a common concern. The issue really comes from gravity, living on a planet with gravity, and everything kind of falls. The upper and mid face typically tends to be more resistant to the effects of gravity, but the lower face, it's where it happens. And a lot of folks have issues with what's called jowling, or where the sides of the mouth, this area, will fall, giving it gives you an appearance that you're actually older than you are, or like some patients say, they look like their mother, they look like their grandmother. So some of the best ways to approach this, you can either look at it from a surgical standpoint, in which case you're looking at a lower facelift, or things that are going to suspend the areas which are jowling or sagging. There's primarily two areas, or two treatments that we use for this, and one are facial fillers, and the other are thread lifts, PDO or PLLA thread lifts. And they kind of approach the issue differently, but the end result is the ability to suspend or reverse the gravitational effects of aging on the lower third of the face. An additional thing that we sometimes do in this area, after a thread lift or a filler treatment to raise the mid face and pull the lower third of the face up, is actually addressing some fatty deposits, which invariably will remain even after facelift. You might see this. So if you do the surgical method, you might actually have liposuction performed in these areas in addition to the facelift. If you do this with non-invasive tools, even after PDO thread lift or mid-face volumization, you're going to want to return to these jowl areas and actually melt it with a substance called deoxycholic acid or Kybella.